Good afternoon, everyone. Thank you for joining us today for High Performance Healthcare Facilities. My name is Jessica Cabina, and I will be the moderator for today's course. Now I'd like to introduce your instructor for today. Erin McFarland is a sustainability research and writing professional based in Boulder, Colorado. Erin began her career in sustainability communications in Chicago at an international architecture and design firm focused on energy efficient and sustainable buildings, cities, and master plans. She spent several of the last years at a consulting firm working in energy efficiency program implementation for utilities and municipalities. Without any further ado, here is your instructor, Erin McFarland.
So let's begin with a background on healthcare facilities. Specifically, what are some unique aspects of healthcare facilities? Well, they aim specifically to improve human health. They often run 24/7 with little variation in both operational and occupancy loads, and air quality is of paramount importance. So we're all aware of how our surroundings can affect us both psychologically and physically. So it only makes sense that buildings that are focused on outcomes of health are themselves healthy building systems. So a lot of architects have been employing a new a new approach called evidence-based design. And it uses research that shows that environmental elements such as natural light, a view of light, less noise, and subdued color palette can produce positive patient outcomes. So that's something we're going to delve into a little bit more later. So I think that's enough for the negative side of healthcare facilities and their challenges and obstacles. Why don't we take a look at the opportunities to green healthcare? So LEAD for Healthcare, it is a collaboration between the USGBC and the Green Guide for Healthcare, the GGHC. I think we're all familiar with the USGBC body. The GGHC is a voluntary toolkit of green building best practices customized for the healthcare sector. Okay, before we get into my favorite portion of this webinar, biophilic design, I just want to say that if you noticed my typo under CHP systems, I believe I put large-scale buildings instead of large-scale buildings. Point for you. I don't think they're that scary. So biophilic design. What is biophilic design? It's based in biophilia hypothesis, and that suggests an instinctive bond between human beings and other living systems. Biophilic design is based on the theory of biophilia, which contends that human health and well-being has a biologically based need to affiliate with nature. When this physiological theory is related to architecture, it can be deduced that the modern architectural movement in the 20th century inherently contradicted physical and natural processes of human physiology by imposing artificial meaning on the built environment. So I know this is a little theory-based, but in other words, contemporary biophilic design seeks to reconnect the built environment with nature through specific strategies, including the use of windows, daylight, fresh air, plants, and green spaces. If you want to imagine a time you were at the hospital, what might have made you feel better? For me, even seeing, a photo of, an Ansel Adams when you're, maybe waiting for a test result or something, could have kind of a healing effect. So we're going to look here at taking that a bit further at some of the strategies for biophilic design, specifically with daylighting and green spaces. So I think we have time for a case study here, and the one I wanted to include was Laguna Honda Hospital and Rehabilitation Center, and that's in San Francisco. I just wanted to include this because they have done some pretty cool things to incorporate biophilia into their renovation. And it is the first LEED certified hospital. It has 9 healing gardens throughout the hospital, greenhouses, a small farm with goats and rabbits, and greenery inside the hospital as well. They have some green walls. Every patient in the hospital has his or her own window that can be opened. So it really gives that a little bit of agency to someone in the hospital that they have their own operable window, and that each of those windows has views of green spaces that cover 58 acres of campus. And there's also a lot of thoughtful interior lighting throughout the hospital. So it was a major renovation of an older rehabilitation hospital, owned and operated by the city of San Francisco. So it's incorporated a lot of green features. One of the project architects said of the facility, even if you're sharing a room, there's never a person between you and a window. So that's pretty novel for a hospital, I believe. Interior lighting is pretty cool throughout the hospital. They have designed the interior lighting to mimic street lamps. So there are designated focal points and nodes along the streets, the so-called streets, where residents can stop to gaze or talk. The multi-residential towers are linked. There are, I believe, 2 currently, and they're linked by a new modern building that serves as what they call a downtown and main street for residents. The residential towers and the facility's 800 beds are organized quite creatively to overcome social isolation and to help foster a sense of community and connectedness. Each wing is designed as a household. So there's a living room, a dining room, individual bedrooms, while each floor, and it's comprised of 4 rings, function as a neighborhood. So that provides common activity spaces and common kitchen and eating areas. So that is all some pretty forward thinking for incorporating these ideas into a hospital. And I have a couple pictures here if you just want to get some visuals of that.